doctor.
The goal of my research is to utilize a promising new class of medications for the treatment of childhood cancers of the bones and muscles. Currently, the best treatments we have for cancers of the bones and muscles include chemotherapies, radiation, and surgery. Chemotherapies, while they're the most effective medicines we have a lot of toxicities in children. So chemotherapy can cause the immune system to be very, very impaired, which make children at risk for very serious infections. And additionally, chemotherapy can cause patients to have long-term side effects. What we are studying in the lab is a class of medications called mTOR inhibitors. mTOR is a protein that's present in the body that normally causes cells in the body to grow and survive. But in cancer cells, mTOR becomes overactive, overstimulated, and that can cause cancer cells to grow and survive. mTOR inhibitors seem to be very well tolerated and seem to have very mild side effects when you compare them to the chemotherapy regimens we have available today. So what we want to do is understand why cancer cells become resistant to mTOR inhibitors so we can better use this class of medicines.
Won't tickle. Just want to make sure everything feels okay.
Rena is one of my patients who suffers from a cancer called rhabdomyosarcoma. What her therapy entails is multiple hospital admissions to even receive the chemotherapy. And the side effects that come from this chemotherapy include lots of serious impairment of the immune system and risk for really serious infections. So for a patient like Rena, if we're able to maximize the effectiveness of medicines like mTOR inhibitors, we may save patients like Rena side effects such as serious infections, problems with fertility, and even the chance that she could develop other types of cancers down the road. 4 out of 5 children diagnosed with a cancer in childhood will ultimately survive their cancer. Unfortunately, progress in cancers such as rhabdomyosarcoma and cancers of bones has lagged behind other types of cancers. So what is exciting about mTOR inhibitors is this gives us a new type of medication that's shown great promise in these medicines. So if we can really learn as much as we can about this class of medicines, we really have a chance to improve outcomes for hundreds of children diagnosed with these types of cancers every year.